Smith-Lemli-Opitz syndrome. What is Smith-Lemli-Opitz syndrome, also known as SLOS? SLOS is a metabolic disorder caused by a mutation in the DHCR7 gene, or the 7-dehydrocholesterol reductase gene, which is located on chromosome 11. The DHCR7 gene codes for an enzyme that is involved in the production of cholesterol. A person with Smith-Lemli-Opitz syndrome isn't producing enough cholesterol, and this is a problem because cholesterol is an essential component of the cell membranes and tissues of the brain. And therefore, if a person can't make enough cholesterol, they will experience poor growth, developmental delays, and mental retardation. These are the symptoms that are typical of Smith-Lemli-Opitz syndrome, and people with this disorder may also have a range of physical malformations, such as extra fingers or toes, and problems with internal organs such as the heart or kidney. How do people get SLOS? SLOS is inherited in an autosomal recessive pattern. If a disorder is said to be inherited in an autosomal recessive pattern, it means that a child has inherited two mutated genes, one from each parent. A child will not have the symptoms of SLOS unless both parents pass on a defective copy of the DHCR7 gene, and this can only happen if both parents are carriers. A carrier is a person who has one good copy and one mutated copy of the DHCR7 gene, but does not experience any symptoms of SLOS themselves. If both parents are carriers, each of their children will have a 25% chance of inheriting the disorder.
How is SLOS diagnosed? Physical findings. Often a routine ultrasound can highlight distinct physical abnormalities before the baby is born, or blood serum can be tested for a higher than normal concentration of 7-dehydrocholesterol or an elevated 7-dehydrocholesterol to cholesterol ratio. How is SLOS treated? Smith-Lemli-Opitz syndrome cannot be cured, and the severity of SLOS varies greatly in affected individuals. Medical treatment for SLOS is unique to each child and largely focuses on the specific problems that the child is experiencing. Interesting facts. At first, SLOS was named RSH, denoting the initials of the first 3 patients diagnosed with the syndrome. However, after some time, it was changed to its current name to honor the 3 geneticists that first described the disorder in 1964. It is thought that the prevalence of carriers could be as high as 1 in 30 in some populations. 1 in every 20,000 babies in the US have this syndrome.